So we have a 57-year-old man, and he presents with slowly worsening walking over the last few years, and it has become slower in his walking, particularly difficulty in turning around. The last 2 years, he has developed shaking on his right hand and has difficulty in doing his button up of the shirt. Scenic examination is hypomimic and hypophonic voice. He has the resting tremor prominent in the right side. Increased tone with cogwheeling that is greater in the right arm as compared to the left side. He also has a difficulty in fine finger movement. On the right side, he has stoop gait and decreased arm swing. The rest of the scenic examination is normal. Well, this picture what he has given is very clear-cut picture of Parkinson. Without going into the option, if you look into this, well, long history, problem in the hypophonia, hypomimicria, difficulty in button up, tremors, cogwheel rigidity, and arm swing. Typical history of Parkinson. That is very clear. Well, now he says, which was the best effective initial treatment for this patient? So in the previous slide, we could conclude that he's talking about Parkinson. And now he didn't mention anything about Parkinson, but he says, what the best initial treatment? So now I can put like this also. What the best initial treatment for a Parkinson patient? Okay. The answer of this drug is levodopa. Why levodopa? Why not others? Well, the most likely diagnosis of this is Parkinson disease, the point I told you in the favor. And in this patient, we are getting classical triad of tremor on the right side, bradykinesia and rigidity. Again, cogwheel rigidity also in the question had been mentioned. So he has made very clear that we are dealing with a case of Parkinson. Now, what are the guidelines? Okay. Guidelines are levodopa is the most effective treatment in terms of controlling the motor movement, motor symptoms like bradykinesia. Okay. Levodopa is problem has the earlier development of motor fluctuation compared to dopamine agonist. There's a drawback also. Okay. One more thing, we always combine levodopa with carbidopa. Okay. Now, what are the disadvantages of dopamine agonist? Okay. They are less effective in controlling motor symptom. That's why levodopa is preferred over dopamine agonist. Now, again, I have a question for you. Write down the answer. Give me any example of dopamine agonist, drug that we use in Parkinson. Well, the answer is amantadine. Okay. And they are more likely to cause side effects such as impulse control disorder, daytime sleepiness. That's a one problem which nobody wants. The patient is sleeping all the time. So, thus patient involvement in treatment decision making is crucial in Parkinson's disease management, because we have to see what the patient age, stage, and what his work profile is. Everything has to be taken into consideration. However, in general, levodopa is always the first line treatment, especially when bradykinesia is the main problem. Well, in the previous slide also I asked, levodopa is usually given in combination with carbidopa. Now the question is why it is so. Why it is so? Write down the answer. Well, the answer is carbidopa is a drug given to patients with Parkinson's disease to inhibit peripheral metabolism of levodopa. Usually when levodopa is given alone, a good percentage, about 90% get metabolized in the peripheral tissue. In the periphery only, it doesn't enter the brain. Only 5 to 7% enter the brain. And remember, we need effect in the brain, not in the peripheral tissues. Okay. So now this peripheral in the peripheral tissue, this conversion, degradation of levodopa is inhibited by carbidopa. So now it allows a greater portion of the peripheral levodopa to cross the blood-brain barrier for CNS effect. So now the concentration in the brain will go, and now moreover you have to give lesser dose of levodopa also, because carbidopa is acting like a helmet for the levodopa. Now let's look into other option. Entacapone is a catechol O methyltransferase, that is COMT inhibitor. COMT inhibitor that can be added to levodopa to try and reduce motor fluctuation. It is not the first line treatment. Saligerin is a monoamine BMAO B inhibitor, which only modest ability to relieve motor symptom. It can again be added to try and relieve motor fluctuation with levodopa. So we are adding 2 drugs in levodopa. But again, I have few questions for you. Write down the answer in your copy. Dopamine is made from which amino acid? Very basic question. And how saligerin and entacapone help in treating a case of Parkinson? Well, we discussed that they are the MAO-B inhibitor and COMT inhibitor I discussed. But what are they going to do? How they are going to, why they are added for levodopa? Okay, yeah. So for that, we have to see this beautiful table, and that's a self-explanatory basic sciences question, but very, very important to know the basic concept. So it is tyrosine, which get converted into dopa and dopamine. Ultimately, it goes to norepinephrine and later on epinephrine. So you can see all catecholamines are made from tyrosine. Now, dopa is converted into dopamine by dopa decarboxylase. Now come the main point. Now, this dopamine is degraded, broken down by COMT or MAO. Both they break down dopamine into its byproducts. Okay. Now, when we give COMT or inhibitor or MAO inhibitor, so they will inhibit the breakdown of dopamine in the peripheral tissues. With the result, more and more dopamine will be available to go into the brain. So that's why they are add-on drug. So now you'll be needing lesser dose of dopamine, definitely. Lesser dopamine will be needed. That means that will reduce the motor fluctuation that we are getting. We usually get with the dopamine therapy on the long-term use. So that's why, since they are simply going to reduce the breakdown of dopamine, that's why they are usually not the first line treatment as such. They're always add-on therapy with dopamine. That's the basic concept. Okay. Now let's talk about other option. Benzaxole is an anticholinergic drug. We don't use nowadays. Well, anticholinergic drug have some modest benefit of treating the tremors of a patient of Parkinson's disease. It should, so that means the patient has bradycardia is the main problem, then levodopa is more effective. The patient has tremor is the main problem, then anticholinergic drugs are going to benefit. But it should not be given in patient above 60 years. It's better to give below 60 years. Now, again, the question is, write down the answer, why you don't want to give to patient above 60 years. Well, the answer of this question is when you are giving anticholinergic drug that can lead to urine retention, it can lead to constipation, etc. So there are many side effects which already normally happen in a patient of elderly people like above 60 years. So like patient having BHP, already has urinary problem. If you give anticholinergic drug, they are going to cause more and more urine problem, more and more constipation, more and more dryness of the mouth, which the patient will not accept it. So that's why they should be avoided in patient in above 60 years. Propranolol or beta blocker rarely effective in managing tremor or Parkinson's disease. They can be useful in treating essential tremors. Okay, so they say they are not to be given in case of Parkinson. Golden line to remember: first line treatment of patient with Parkinson with bradykinesia is levodopa or levodopa and carbidopa. In fact, this is the one which is used usually. Well, I hope you liked the session. Just to inform you, we have following courses for you. Smart Medicine, there are 350 hours of pre-recorded video lecture of whole internal medicine. It includes all super specialty and allied subject, covering A to Z, including basic concept about every topic. Second, we have tests and discussion. There are more than 1,000 questions with discussion of the questions, sample question and discussion you saw in this session. Now, third thing is Medicine Simplified, which is a textbook of medicine. Harrison is the ultimate book to read medicine, but it is too vast. Reading one page of Harrison, you need half an hour. To understand, you need 2 hours, but you need only 2 minutes to forget what was written in that page. Then what is the solution? We have Medicine Simplified. It's a textbook of medicine, but so-called mini Harrison. It's a summary of what you need to read from Harrison. The book is available in Amazon also. Now, these 3 things are more than enough for your MD, DNB Medicine and Family Medicine final exam preparation, NEET SS exam preparation. You don't need to read any other book. These 3 are complete in all the aspects. For more detail, you can contact at this number. It's a mobile as well as WhatsApp. And this is my personal email ID. Anybody want to reach to me, you can contact me at this email ID. Thank you very much.